Good morning, I'm Jody Hall, and I own a business in Seattle called Cupcake Royale, and we have soon to be four locations. We're opening our fourth. We've been around for 5.5 years, and we have about 60 employees. And
what happened to the cupcakes? Because I saw something.
Well,
and I was hoping they were for me.
We'll talk later.
Well, I want to get right to the topic that I raised at the beginning of what you're facing right now as you look to try to provide coverage for your workers. Jody, why don't you start us off? You're out in Seattle, and what do you find in the market out there? Tell me again how many employees you have.
Yeah, we have currently, we fluctuate a little bit, but I think we're right around 55 to 60 right now. We're getting into wedding season, so we hire quite a few more people, and we're opening a new store as well. So I guess my story is that I started for a small business that became a huge business. I worked at Starbucks Coffee when they were a tiny little company.
Wow.
And grew up there, learned a lot about how to run a business and how to treat your employees well. And I spent 12 years there. Amazing values. They offered health insurance if you work 20 hours a week. So of course I took these values into my own business when I started it. And when I offered health insurance, it's a human thing. It's important that the people who work for me have health insurance. I mean, it makes me more viable to attract great talent, etc. But I was shocked at the high cost. Working for Starbucks, I think we paid 25% and the company paid 75%, so I kind of did a similar deal. We probably paid about 45% more for the coverage that was probably much less than half. We didn't have vision or dental. It was more of like a catastrophic kind of plan. So, you know, I really want to offer health care and continue to do that. Right now, if somebody works 25 hours a week, we offer that. But what's happening is costs go up every year, and because of privatized insurance, they really have a corner on the market. So I can't shop that. I can't go to different brokers and get a better rate. What I'm forced to do is decrease the quality of coverage to continue to be able to afford some level of health care.
How do you buy it now? You go to a broker who shows you what's available?
You buy through a broker. So, yeah. And what I'd like to see and why I'm here today is just to ask that you and the President listen to the options for creating a choice for public health care. And what that will do for small businesses, we're the majority of working Americans, and we're the largest pool of uninsured working Americans. So, but we're also the busiest. You know, we're our own HR person, marketing person, etc. We don't have a lobbyist to come to DC. It's hard to get us out of our businesses. So it's important that for this meeting, because we need to organize and help you understand kind of what the real world of what we face. So I'm looking at 10 to 40% increases every year, and I don't have the option to shop that. It's incredible. Like I can't do that to my customers. Oh, we're just going to increase it's a free market. They're going to.
Well, I was going to ask you, you said your premiums went up 40% for this that you're paying this year. So what did you do? Did you raise the price of cupcakes? Or?
We did end up raising the price of cupcakes a little bit to absorb that. I mean, we sell coffee and cupcakes, so I feel like I'm one of the fortunate businesses that can afford it, but I'm just absorbing it. So our opportunity to do other things, to grow our company, etc., we risk that money. And honestly, we'll probably have to decrease our coverage, which I don't think is good for this economy, and I don't think it's good for other businesses. If people want to start their own business, that doesn't sound attractive. You're going to have to pay these high health care costs for less quality coverage. Why would you want to go into your own business? Yet that's the engine of our economy. I mean, I think this would be a great opportunity to stimulate our economy if we can have a public health insurance plan where we can pool our resources and create bargaining power so the big insurance companies don't have a corner on the market. I mean, the cards are stacked against us right now. And I think this is absolutely the time we need this reform this year.